Okay, this next question is a question that we get a lot of times, especially right now in the winter, right? Chief complaint of most people coming into at least my aesthetic room is that people are feeling dry. Makes sense, right? It's been freezing this past week. So of course, Zia, we're always exfoliating a good amount, right? We have to get the dead up and off, the dead skin up and off, so that when we use our serums and our hydrators, they can actually impact fresh, young, healthy cells and not just dead skin that's still hanging around the epidermis. So we definitely want to keep exfoliating this time of year. Again, you can kind of mix it up. Like last night, I tend to get a little bit of skin texture on my right cheek. I think it's because I sleep on this side a little bit more. So I took a little bit of dual action scrub, and with like room temp water, not super warm, not super cold, I took a little bit of dual action scrub and some complexion clearing mask, and I just kind of mixed it together in the palm of my hand and then gently kind of rolled and buffed it on my skin and then let it sit for about 20 minutes. And you can actually feel it kind of eating away at this, like all those dead skin cells on the surface layer. And so, you know, you do that, you rinse it off, might be a little bit red, which is totally fine, or pink, and then you just, again, heavy dose with the hydration. So I did 3 to 4 pumps of firming serum. I did some daily power defense, and I think that was it. Maybe a little instant pore refiner. Those were the 3 that I did last night. So if you are feeling dry, we can adjust the regimen, right? Zio never wants our patients to get completely reliant on a topical hydrator, right? That's like how most people are coming in. They're using something like an oil or something that's very emollient and not really doing much for the skin. Again, just kind of trapping and occluding the epidermis. We really want to work the layers of the skin. So we're trying to get your skin to be more efficient by creating that hydration from the deeper layers of the tissue. But again, we're New Englanders, sometimes you just feel dry. So we can either increase pumps or dosage. That'll kind of be driven by your provider. And then we can also kind of switch up products here or there, right? Maybe you're going to reach for a recovery or a renewal cream 2 or 3 nights a week just to kind of get you through these next couple months. So the pumps or the dose differs for each person, right? My bet is if you are feeling a little bit dry, like you're using daily power in the evening and maybe you're only using 1 pump, easily you could go up to 3 pumps and probably feel a lot better. Also, make sure that you are exfoliating. If you are using some of the exfoliating products like dual action, like polish, and your skin is super reactive, then we still need to do a little bit better work on barrier repair, because we want the skin to feel healthy. We don't want every single time you put something on your skin that's like mildly abrasive for it to feel tingly and stingly. That means that we have a barrier issue and we still need to work through that. So if you are having issues ever with dryness or just the amount of product that you're using, it doesn't feel like enough, you don't feel like your skin is giving you that oomph factor, then reach out and we will adjust. But usually it comes down to pumps or dosage. So we can adjust anything that you may need.